Hi, I'm Matt Rosetta, the CEO of N6A, and this is Essentially Heroes, where each day we're speaking with a different essential worker who's on the front lines battling against COVID-19. And today we have a very special guest, Stephanie Culler. Stephanie is the co-founder and CEO of Persephone Biosciences, who's also a proud partner of N6A. Stephanie, thanks for being here. Great to see you.
Thank you.
And Stephanie, you're out in San Diego, correct?
Yes.
Awesome. So Stephanie, up until a few weeks ago, you were heads down focused on Persephone's noble quest in the fight against cancer, and then you pivoted recently to be of aid to the public in the battle against COVID. Maybe you could just tell us a little bit about what Persephone does and then what you're doing recently to address COVID.
Yes, absolutely. So at Persephone Biosciences, we're developing what we call microbiome therapeutics. And for the last 2.5 years, we've been working on cancer. And really, our motto has been, we are changing biology to end cancer. And a number of years ago, it was discovered that the bacteria that we have in our gut can impact curative immunotherapy drugs. These cancer drugs, some of them you may have heard of, called Keytruda, for example, enable a cancer patient's immune system to fight cancer, essentially recognize, attack, and kill cancer. But these drugs, while can be a real cure, we can actually say they're cures to cancer, don't work for most patients. About 70 to 80% of cancer patients fail to respond to these curative drugs. And what was found was that gut health is actually very important for how well these drugs work. That the microbes that we have in our gut can basically impact how well a patient will respond, either becoming a non-responder, which is most cancer patients, or being a responder. And why that is the case, and I think why this is important for the coronavirus and us in terms of immune health, is that 80% of our immune cells exist in our gut. 80%. And so the bacteria that we have and what they produce has a profound impact on our immune system. The gut microbiome that we have evolved with is essentially to promote normal immune health to prevent disease like cancer. And in some cases, obviously, to fight it. And so what we have discovered over the last several years in terms of cancer is that there are a core set of bacteria in the gut that modulate the immune system. And so our therapeutics are those core set of gut bacteria. And they will be delivered essentially in an oral capsule. And for cancer patients to be taken alongside of their immunotherapy drug to essentially convert cancer patients who would normally otherwise be a non-responder to becoming a responder. Could we go from 20% or 30% potential cures to 50% or higher? That's our mission at Persephone. And over the last several months, what I have come to recognize with the coronavirus and what's been in the literature with regards to the microbiome and vaccination and fighting off viruses is that the same immune responses that cancer patients need to fight cancer are the same immune response that people need in general to fight off the virus. Wow. And so we started to evaluate what we've been developing for cancer. Could this work as something that could be preventative to the coronavirus or important for first responders? Could it help them, once exposed, help them fight off and clear the virus a lot quicker so it doesn't progress? And one other thing that we were looking at, could it help vaccines have longer lasting immunity? One concern that we have in early stages is how long does our immunity last to the coronavirus once we get it? Is it a few years? Is it a decade? We don't have those answers today, but we certainly, when we take it, have a vaccine, we want to make sure it can last as long as possible. And so that's what we're essentially trying to evaluate right now in terms of using our cancer therapeutics and put that in the fight against the virus and hopefully preventing in the future.
Wow, amen. Stephanie, I could talk about this all day long. It's fascinating. Yeah. What could you just share maybe a few of the more notable observations and sort of first observations you've had since you made the pivot to coronavirus?
Yeah. So data's been coming out from China on a daily basis in very high impact publications, as well as many in the United States now across the world, there's been a couple links to gut health and the gastrointestinal tract in particular. There's several studies in China noted that these were several hundred patient studies, noted that many patients at first symptoms actually had GI dysfunction. So issues, diarrhea, and other issues around that. And so that was an initial observation that physicians were making there. But then for many of the patients who claimed initially to have GI-related issues prior to any other symptom, had done worse in terms of their response. Many of them were in the hospital for longer periods of time, and then mortality rates were higher amongst that cohort. Other studies that have been coming out along the GI-related studies have demonstrated that the virus can be detected in stool for much longer periods of time than maybe the oral swabs. And that's concerning because we're still trying to understand, is the virus active in fecal samples, for example, and why would it linger for many weeks after a normal COVID-19 test was negative? They were still positive in their stool samples, but in the nasal swabs, they were negative. So these are things we're trying to figure out. And the FDA has acknowledged this, and that's important for patients who receive what's called FMTs, or fecal microbiota transplants, namely used for Clostridium difficile, an infection that can kill up to 30,000 people a year in the United States. It's a severe infection. Fecal transplants can be a cure for that issue. And so the FDA has now provided additional guidance that potentially many stool samples after the coronavirus coming here cannot be used for that purpose. And so they're recognizing the fact that the virus is in the stool. And then a third a type of data that's been coming out. The virus itself is known to bind to a specific receptor, the ACE2 receptor. What's interesting about all of this is the ACE2 receptor is expressed in the lung, but it's most highly expressed in the colon.
Wow.
And so this can be, this is another prong to the story of how maybe the microbiome is implicating a role. And that receptor has actually been known to be modulated by the gut microbiome. So it's all coming together as we get more and more data, but it's definitely supporting a role for gut health. And it's something that we can all actually, as opposed to many other aspects, we cannot change our DNA very easily today, but we can change the DNA inside of our gut. The microbes can change. And what we need to do today, prior to us getting our therapeutic out there and through the regulatory process by the FDA, is really eating as well as we can, making sure that we have enough fiber in our diets, making sure we eat fermented foods, really focusing on that, as well as obviously exercise. But feeding the good bugs is highly critical. And I think that's been a major challenge, especially with regards to the Western diet.
Got it. Well, Stephanie, so that was my next question, was just going to be, what can we be doing a better job of, number one, to keep you safe, and also just to keep all of the Americans out there safe in this fight against COVID? I guess it really, in your mind, would begin with proper gut digestive health, correct?
Yeah, I mean, that's something we can all really focus on and do something to prepare ourselves. I mean, we want to make sure that everyone can have proper and the best immune function possible, and that's what we're focused on. I would also say, on a personal, diet's very important, but I think in terms of startups, and getting as much innovation out there, it's important. And what we scientists think is that, similar to how we fight cancer, we have to take a multi-pronged approach. Cancer is so complex, it is so challenging, that we have to sometimes take multiple therapeutics and combine them. We may have to do that to really fight off and end the coronavirus. And so, we need to sponsor innovation. The government is, but we are now obviously in a financial challenging situation, and where startups like ours would normally get funding, like from venture capitalists or private equity, a lot of those funds have either been on hold or people are not investing. And so I think right now, and this is something I've talked with a lot of other startups that are trying to do this, we can make progress, but we need capital. And, government funding does take a while, although we're all trying. But I think that, my urge would be for the private institutions to help out with this as much as they can, because we're really getting stuck in terms of moving forward without having sufficient capital.
Got it. Yeah, no, absolutely. And, put the capital in the people's hands who can change the world, such as, yourself and Persephone Biosciences. And there's a lot of good that's happening right now just in the world. We need better access to capital, though, to continue to keep those great businesses alive and thrive.
Absolutely.
Well, Stephanie, thanks so much for being here. We appreciate it. We're super proud to be partnering with you and, joined together on this journey. And keep up the great work. Well, I have to ask you, what's your favorite food, by the way? We wanted to send you and your crew a little meal just to say thanks.
Oh, thank you. That is a very good question.
You're in San Diego, so I was gonna guess Mexican food.
Yes, I love Mexican food, but I really love Italian food.
There we go.
Spaghetti meatballs.
So we'll do two things. We'll send you a great Italian meal out in San Diego. Next time you're in New York, when the world returns back to normal, we'll take you to a great Italian restaurant downtown.
I love that. Thank you.
Awesome. Well, Stephanie Culler, the co-founder and CEO of Persephone Biosciences. Thanks again, Stephanie.
Thank you.
And to everyone out there, be sure to join us tomorrow for another episode of Essentially Heroes with another heroic essential worker who's on the front lines battling on behalf of all of us in this fight against COVID-19. Thanks again, Stephanie. Appreciate it.